Hello, everybody. My name is Fabrício Santiago. I'm a Brazilian vascular surgeon, and I'm here to talk to you about innovations in compression therapy. I have no disclosures for this presentation, but I'd like to thank the organizing committee for this nice invitation. So this is what we've been doing in our private research institute in terms of investigation and cooperation with different national and international centers, including compression therapy investigation. According to some guidelines, this is a 2017 publication, we know that we have strong recommendation gradings up to 20 for using, for example, medical compression stockings in different venous and lymphatic disorders, of course, with different scientific backgrounds, showing that compression therapy works really well. So let's start with PrEP devices. We have been reading some very nice publications. This is an example of one when we are comparing the use of PrEP devices with multi-layer inelastic bandages for venous leg ulcer healing. We know that in this publication there are no differences in terms of ulcer healing rates, but in terms of patient self-management and help required, PrEP devices have a significant statistical difference favoring the use of the PrEP devices. And surprisingly, they are have better cost effectiveness in terms of cost when comparing with the inelastic bandages. At the end of the study, we can see here that they were cheaper to use than the multi-layer inelastic bandages. So we've been using PrEP devices in acute deep venous thrombosis, and we are currently investigating in patients with deep venous thrombosis, comparing these patients with anticoagulation alone. And so far, we've been having very nice results in terms of edema and symptoms improvement, but we need to know further results, especially for post-thrombotic syndrome. So pandemic times have brought us some very hard times or situations, but it has been giving a boost in terms of improvement of telehealth and telemedicine. Telehealth, especially by continuing education for health professionals and healthcare workers. This is what we've been doing now. And telemedicine, especially by allowing us to monitor our patients at home, giving us very precious information. And talking about informations, these are very promising devices. The smart bandages, they contain a microchip that can give us very, very nice information. This is an example of, for example, for wound dressings in the smart bandages, they can inform us about the pH of the wound, the temperature, the oxygen, the moisture, the mechanical and electrical components, and its enzymes. And also can allow us to deliver pharmacological agents and growth factors through MNAs or miniaturized needle arrays. We have some basic science studies showing in animals showing that when compared with no treatment, with the current normal topical treatment and microneedle MNAs, we have a better improvement in ulcer healing with the MNAs used in the smart bandages. So this is another promising situation. The microsensors or the sensors along the skin below the use of compression therapy, and in vitro investigations have been shown very nice results in terms of informing the interface pressure measurements. And in the future, probably they will allow us to know the convenience of using compression therapy, the comfort, the compliance of the patient, the clinical improvement through the digitalization of compression therapy information. So we have some investigations with the SACs or smart active compression stockings. These are stockings that have a pumping effect, causing with very good interface pressures, but also the preliminary results in normal patients are showing that they can increase the popliteal peak flow velocity when compared with the normal state with no compression, and also can decrease small saphenous veins and great saphenous vein diameters. We were talking about the telehealth, and we cannot let mentioning the continuing education importance of the compression therapy, and by giving us very good education and information. This is an example of Food for Veins and Vein for Foods initiative with more than 23,000 live attendees talking also about wound care and compression therapy. And we need to explore more the electronic tools for the public health awareness. This is a publication, an investigation with patients with that have never used the compression stockings, and after the public awareness, we have a very good result in terms of uh, using more the compression stockings after understanding what was the importance of using compression stockings. Understanding and changing concepts, although some of them they are not new. We have some publications in by giving and receiving, especially these informations, online informations. Here in Brazil, we've been having very good webinars on compression therapy. For an example, when we are comparing progressive compression therapy with graduated compression therapy, according to the literature, we have some more pronounced effect on venous pumping and better compliance of the patients with the use of compression, the progressive compression. And this is probably a very good situation for the future. And when comparing, for example, or original and the modified physics laws, this is an example of comparison of the the original Laplace law with the modified one by understanding the results that we have in compression therapy in vivo patients, and the publications have been showing that the modified Laplace's law is more accurate with very good situations. The errors in theoretic values between modified and original the Laplace's law are in the range of 1.47 to 3.83% is acceptable. So compression in peripheral arterial disease, it's very important to understand that, we have some colleagues understanding that in the recent times that we have no contraindications on using appropriate compression therapy in patients with mixed ulceration, especially those patients with ABI index, ABI greater than 0.5 and the absolute anchor pressure more than 6 millimeters, by using inelastic compression materials with up to 40 millimeter interface compression. So it's very nice to be here with these online meetings. We've been learning a lot with that, but I'm eager to get back to in-person meetings and meeting you all so that we can exchange information not only in the conference rooms, but also in the corridors. Thank you very much.